The topic of our video is whether the angiography procedure is performed through the wrist or the groin. Is angiography through the wrist worse? Is it better? Is angiography through the groin riskier? Will it provide us with more detailed information? Let's put an end to this issue. In Turkey, interventional cardiologists have been performing the angiography procedure for over 40 years. Until the last 10 to 15 years, the routine for angiography was through the groin. The procedure involved entering through the main artery in the groin, sending catheters through it to reach the heart with a thin tube and imaging the heart's blood vessels. However, angiography through the groin, especially in the area where catheters are used, was found to cause complications such as bleeding, potential nerve damage at the entry site, and the patient being bedridden for several days after, unable to move. The discomfort during the 12-hour period following angiography, spent lying with a sandbag on the groin, encouraged cardiologists to seek alternative areas for new interventional procedures. And now, as of the latest updates, we are performing angiography through the wrist. There is no difference in the detailed imaging or quality between angiography through the wrist and angiography through the groin. On the contrary, the risk of bleeding is much lower with wrist angiography. The risk of nerve damage is also lower. When angiography is done through the wrist, a small bandage is applied to the area and the person can be sent home after just 3 hours. In other words, within a 3-hour period, the person becomes ready to leave the hospital. In a standard angiography, the patient has to wait lying on the bed with a sandbag on the groin for 12 hours in some places, 6 hours in others. Even when the sandbag is removed, the risk of bleeding does not disappear. After the removal of the sandbag, when the clot that closes the hole where the needle entered is dislodged, bleeding can occur again. In recent times, wrist angiography has replaced groin angiography. Wrist angiography is now considered the gold standard by guidelines, meaning it is considered the first choice angiography procedure. Currently, wrist angiography has surpassed groin angiography. Groin angiography has no superiority over wrist angiography. On the contrary, wrist angiography is more comfortable with lower risks of bleeding and injury. Now, let's discuss when we cannot perform wrist angiography. While performing groin angiography, we can examine both the heart vessels and the femoral arteries. However, when we perform angiography through the wrist, we cannot visualize the femoral artery. Occasionally, one side of the femoral artery can be visualized, but the other side cannot. It's important to note that if both the heart and femoral arteries need to be visualized in the same session simultaneously, there is no issue with opting for groin angiography. However, if only the heart vessels need to be imaged, wrist angiography is always superior for us. I often hear from my patients that groin angiography provides more detailed images, that the vessels are clearer when angiography is done through the groin. There is no truth to such claims. Angiography performed through the wrist and angiography through the groin use the same catheters and tubes. They reach the heart to visualize the heart vessels. However, let's say that in the wrist artery, the same situation can also occur in the groin artery. Suppose there is a blockage or a severe bend that cannot be passed. In that case, the procedure may switch to the groin. The same applies within the groin. The groin artery can be blocked in patients with leg vascular issues. In such cases, transitioning to the groin may be necessary. However, in routine practice, angiography through the wrist is superior to groin angiography and should be the first choice. It has a lower risk of bleeding and provides greater comfort. Wrist angiography is now the primary procedure for us. If you are undergoing a standard angiography procedure, we recommend opting for wrist angiography. Don't forget to follow us for more information on heart vascular health. Goodbye.